Good afternoon, everyone. How many of you have encountered patients struggling with Meniere's disease, tinnitus, or other ENT conditions and wish for more effective treatment methods? Please type yes in the chat if you've ever felt the challenge of treating these complex disorders. My name is Myra Chen, and I'm your host and moderator for today's eLotus webinar. At eLotus, we have been hosting educational courses for over 3 decades and are proud to be your trusted source for premium CEU content, featuring over 200 speakers, 700 courses, and 3,000 hours of CE. Today, it's my pleasure to introduce our speaker, Dr. Tsu-Chen Kao. Dr. Kao is an expert in Chinese medicine and a recognized leader in Yamamoto New Scalp Acupuncture, YNSA. With years of clinical experience and specialized training in Japan, Dr. Kao has successfully treated various neurological disorders and is a chairman of the YNSA Taiwan branch. He also teaches around the world, helping practitioners integrate this advanced method into their practices. Today's course is Latest YNSA Protocols for Meniere's disease, tinnitus, and other ENT disorders, sponsored by Evergreen Herbs. Dr. Kao will dive deeper into his latest YNSA protocols specifically, offering you advanced techniques to help improve patient care and enhance your practice. Dr. Kao has also taught 2 introductory YNSA courses with us last year that has been archived in our library for those who want to review the material. And he has also held a previous webinar called Latest YNSA Protocols for Stroke, Parkinson's, and Other Neurological Disorders earlier this year. And if you're already skilled in YNSA, you will find Dr. Tai's scalp acupuncture an excellent complement to your practice. We provide free resources to help you master these techniques, including informative videos on our YouTube channel and in-depth scalp point and zone guides on our core platform. Core offers detailed descriptions, practical applications, and expert insights into these powerful methods, which are particularly effective for post-stroke rehabilitation and managing neurological disorders. Be sure to check out these free resources to enhance your expertise and clinical results. I will share the links to Dr. Kao's courses and Dr. Tai's scalp acupuncture in the chat room for you to explore. We hope these resources we have compiled will enhance your expertise and clinical results. And before we begin, a few housekeeping items. Please set your chat to everyone to ensure your comments are visible to the whole group. And feel free to ask questions in the Q&A box during the presentation. And remember, the CEU quiz will be available by the next business day for those who meet the participation requirements. Now, let's get started with today's webinar, and please welcome Dr. Tsu-Chen Kao.
Good morning, everyone. Can you hear me? Okay, nice to meet you.
Good morning, Dr. Kao.
Okay, welcome to Yamamoto New Scalp Acupuncture online course again. I'm Dr. Kao, the superintendent of the YNSA Taiwan branch based in Taipei. It has been 2 months since we last met, and I truly miss seeing all of you online. I hope you were satisfied with previous seminar about neurological disorders. Today's topic is okay. Let me change to our slides. Okay. Today's topic is latest YNSA protocols for Meniere's disease, tinnitus, and other disorders. These sessions will be a little bit more advanced and with more contents and slightly higher level of difficulty. It's especially designed for returning participants, those of you who join us in previous course and have already some existing experiences with YNSA. And it is my pleasure to share with you of my insights, clinical case studies, and hands-on experiences in this field. Okay, so let's start it. Please take a look at today's outline. We'll begin with a brief introduction to YNSA and then move into clinical application of neurological conditions. First, we'll cover Meniere's disease, followed by tinnitus, sudden sensory neural hearing loss, vestibular neuritis, and olfactory dysfunction, dysgeusia, acoustic pneumoroma, puerperosis, otolalia. And then allergic rhinitis, mouth, tongue, and tooth pain, hoarseness, restless leg syndrome, cryoglobulinemia, Miller-Fisher syndrome, and REM sleep behavior disorder. And then, since the majority of this course focuses on the treatment of ENT, about ear, nose, throat disorders, the sections of somatotopes will be highly similar. You may notice that many repeated somatotopes, and we kindly ask for your understanding. This one. Hey, how about Meniere's disease? Meniere's disease is an inner ear problem that can cause dizziness, also called vertigo, and hearing loss. Most of the time, Meniere's disease affects only 1 year. The definition of this disease is that paroxysmal spinning vertigo lasting more than 20 minutes. Meniere's disease can happen at any age, but it usually starts between the ages of 40 to 60. It's thought to be a lifelong condition, but some treatments can help to ease symptoms and lessen how it affects in your life long term. About causes of Meniere's disease are allergies, abnormal immune system response, head injury, migraine headaches, viral infection, and endolymphatic hydrops. However, the exact mechanism is not yet fully understood. It means that most of patients didn't know the mechanism and reason for the Meniere's disease. I think it is very common disease about the people, because sometimes the people just feeling about dizziness without any reason, and after they go to the physicians, the doctors will tell the patient what they are. Most of them are Meniere's disease. The symptoms of Meniere's disease include vertigo, nausea, and vomiting. You have a spinning feeling that starts and stops suddenly. Vertigo may start without warning. It is usually lasts 20 minutes to 12 hours, but not more than 24 hours. Serious vertigo can cause nausea. Tinnitus. Tinnitus is a term for when you have a ringing, buzzing, roaring, whistling, or hissing sound in your ear. Hearing loss in Meniere's disease may come and go, especially early on. Over time, hearing loss can be long-lasting and not get better. About basic points, I will use the A points. About sensory points, I will use tinnitus points. About brain points, I will use cerebrum points. About 12 cranial nerve points, I will use the vestibulocochlear nerve points. It means cranial nerve 8. About Y points, I will use spleen points. Okay, let me show the laser pen. Okay, here is A point, and here are 4 tinnitus points. 1, 2, 3, 4. About brain points, I'll use cerebellum points. And this ear point is equal this one, tinnitus 4. These are the same points. Okay. Okay, and then this is cranial nerve 8 point, vestibulocochlear nerve points. And then this is spleen points. Here's outcome. Complete recovery of Meniere's disease is possible, requiring approximately 12 to 18 treatment sessions. Symptoms recovery sequence of Meniere's disease is that dizziness and then nausea and vomiting, hearing loss, Finally, is tinnitus. Okay, it means that when we use YNSA to treat the Meniere's disease, the dizziness and nausea will recover very soon, and then the hearing loss. The finally is tinnitus. Because in our ENT disease, tinnitus is very difficult to be cured. For example, sometimes we treat for ENT disease, the tinnitus will become better at the early stage, but they will stop at one level. For example, maybe I think the patient's hearing loss is recovered for 50% to 60%, but they may stop at this stage. Their tinnitus cannot be alleviated more. But hearing loss is not a very serious problem in Meniere's disease. Maybe in my personal experiences, the Meniere's disease is the hearing loss of Meniere's disease is almost below for low frequency. For example, 25 hertz or 500 hertz. In the hearing, the lower hertz means that the voice is low. The high frequency of the hearing, high frequency of the hearing means the higher voices. For Meniere's disease, most of the hearing loss is low frequency. And then, besides the Meniere's disease induced by COVID-19 vaccination, shows relatively poorer treatment outcomes. This is my experiences. I think the AstraZeneca vaccine injection for the patients who got a Meniere's disease is not very good because I have tried for many times, but they are not effective. Okay, and then let me introduce the key points. Tinnitus points, cerebellum points, and vestibulocochlear nerves points are important. Okay, I think you don't need to doubt about these points and these points. How about cerebellum? Cerebellum points is used for the balance and dizziness problem. It is very useful for the balance problem and dizziness, nausea, and vomiting. I think it's very good. Now, I will introduce the case report. 6 months ago, a 75-year-old female suddenly experiences dizziness, tinnitus, and unsteadiness while walking. Pure tone audiometry revealed a slight hearing loss in left ear, though through the exact hearing level was undetermined. She was diagnosed with Meniere's disease by an otolaryngologist. Current symptoms are dizziness, tinnitus, and hearing loss. About ICD-10 code is G20, Meniere's disease left ear. About Hoku diagnosis, I found left cervical area exists positive reaction. About upper extremity diagnosis, I found left cerebellum area, left and right cerebellum area exists positive reaction. About neck diagnosis, I found right spleen area exists positive reaction. About YNSA somatotopes, basic points is left A points. Sensory points is right tinnitus points. Brain points are left cerebellum points and right cerebellum points. 12 cranial nerve points is right vestibulocochlear nerve points. Y points is right spleen points. Here is the result. Third visit, both dizziness and tinnitus showed improvement. Gait become more stable. Sixth visit, dizziness and tinnitus resolved. Pure tone audiometry confirmed that hearing in the left ear had returned to normal. Okay, I think this is a very successful cases because the patient only received 6 times treatment and the symptoms disappeared. And in my opinion, I think the Meniere's disease, hearing loss of Meniere's disease is usually not serious. for my experiences, maybe the low frequency of hearing showed 40 or 50 decibel is it is very serious. But in this case, it is resolved very fast. But because the patient didn't give me the PDA pure tone audiometry test, so I cannot share about this. How many hearing data? What is the data we have to I have seen? So the patient just tell me, oh, the hearing is fully recovered. And then in this ENT disease, the most difficult is that tinnitus, because it is not such it is determined that patient feeling. So we physician cannot cannot test for the tinnitus. We just very depends on the patient's feeling. Okay, maybe this is the ENT disease for difficulty of the ENT diseases. Oh, and then please do me a favor to share the Meniere's disease treatment video. Thank you so much. Let me introduce the treatment of Meniere's disease. Here is A point. Here is tinnitus 1. Here is tinnitus 2. Here is tinnitus 3. Here is spleen point. Here is tinnitus 4. It is also equal to ear point. Here is cerebellum point. Here is vestibulocochlear nerve point, cranial nerve 8. This is the treatment of Meniere's disease. Okay, thank you. And then maybe just move on to previous slide, because maybe I just give you more explanation for the somatotopes. Maybe some students, they don't realize what is that. Okay, sorry. Oh, let me share again. Maybe you just learned it from previous videos, previous seminars. Okay, so I just explain here again for briefly. Okay, briefly, because I say just they are almost repeated in the other ENT disorders. So I just introduce here, and then I will give you the right directions after slide is the slide is over. Okay, so let me introduce again. Okay, 8 points. Maybe A points is located bilateral for 1 centimeters for the sagittal plane. This is sagittal plane, right? And this is 1 centimeters here, and then go up to 1 centimeter and go down to 1 centimeters. The length of A points are 2 centimeters. And then cerebellum point is located from 1 centimeters and go up to 3 centimeters from the hairline, naturally hairline, 3 centimeters. And then ear points is in the middle line from nose and mouth points, middle line, and just draw a line from C points to the nasal root. This is ear point. This is just a brief review for previous seminar, previous video. And then here about the tinnitus points. The first tinnitus one is located upon the ear point. And then you have to draw an arc from tinnitus 1 to 4. Tinnitus 2 is located from the intertracheal notch and draw a line from the intertracheal notch to the ear apex. And then the intersection of the arc and this line is tinnitus 2. And then tinnitus 3 is a vertical line from intertracheal notch and the intersection of the intertracheal notch and the arc. This is tinnitus 3. Tinnitus 4 is the same of this ear point. Okay, and then about 12 cranial nerve 8, you have to find the 6 centimeters height from A points to the length of the 12 cranial nerve points is almost about 6 centimeters. And you have to know that these 12 cranial nerve points will not go across the coronal plane. This is coronal plane, right? This is sagittal plane, coronal plane. They won't go over the coronal plane. And then the vestibulocochlear points is about 1/3. The length of this one is 1/3, right? This is vestibulocochlear nerve points. And let's spleen the spleen area. A spleen point is that I have showed about Y points in previous video, right? Okay, here is an ear point. Yeah, not ear, sorry. Here is an ear, and you have to find the lung, large intestine, urinary bladder, and then the spleen is on the second axis from pericardium, between pericardium and urinary bladder. Okay, this is the middle side of this. This is the second axis, and pericardium and urinary bladder. You have to find this point and this point, and a spleen point in the middle side of these 2 points. Okay. Okay. Let's continue for the cases. Okay, let me show tinnitus. Tinnitus is when you experience ringing or other noises in one or both of your ears. The noise you hear when you have a tinnitus isn't caused by an external sound, and other people usually cannot hear it. Tinnitus is a common problem. It affects about 15 to 20% of people and is especially common in older adults. Tinnitus is usually caused by an underlying condition such as age-related hearing loss, an ear injury, or problem with circulatory system, but the most common cause is idiopathic. It means that we didn't know the reason for tinnitus. In fact, tinnitus is also accompanying symptoms of such as hearing loss, Meniere's disease, or another ear problem. Tinnitus is most often described as a ringing in the ears, even though no external sound is present. However, tinnitus can also cause other types of phantom noises in your ears, including buzzing, roaring, clicking, hissing, and humming. Most people who have tinnitus have subjective tinnitus, or tinnitus that only you can hear. The noises of tinnitus may vary in pitch from a low roar to a high squeal, and you may hear it in one or both ears. In some cases, the sound can be so loud that interferes with your ability to concentrate or hear external sounds. Tinnitus may present all the time, or it may come and go. In rare cases, tinnitus can occur as a rhythmic pulsing or whooshing sound, often in time with your heartbeat. It is called a pulsatile tinnitus. If you have pulsatile tinnitus, your doctor may be able to hear your tinnitus when he or she does an examination. About basic points, I will use A points. About sensory points, I will use tinnitus points. About brain points, I will use cerebrum points. About 12 cranial nerve points, I will use the vestibulocochlear nerve points. About Y points, I will use spleen points. Okay, you can see that most of the points are the same, especially brain points. Now, I think cerebrum point is useful. Okay, because I showed this graph previously, now I'll demonstrate the brain point. Okay, here is A point, just as the same for 1 centimeter here and 1 centimeter height here. A points, and here is ear point. Ear point is about the middle of this line, and the line from the intersection of this line and C to nasal root is ear point. And then brain cerebrum point is located as the same as A points is from 1 centimeter from the intersection line, and then go through 2 centimeters from the hairline, 2 centimeters. And cerebellum point is 3 centimeters. Okay, cerebrum point is 2 centimeters height from the hairline, as cerebellum point is 3 centimeters. Okay, the tinnitus point here is about tinnitus 1 located above the hair apex, and tinnitus 4 draw an arc from, and then tinnitus 2 is intersection from intersection notch to apex here, and the vertical line here, and the and arcs this is tinnitus 3. Okay. The vestibulocochlear nerve point is located on the line for 6 centimeters, and this for 1/3. And this is vestibulocochlear. And then the spleen areas I just mentioned, from if we have to find urinary bladder first and pericardium and draw an axis from. This is temporal bone. All of this area is in front of the ear and on the temporal bone, and here is spleen point is located between pericardium and urinary bladder. Okay, here's the outcome. Short-term efficacy of tinnitus is greater than long-term efficacies, because in my experiences, tinnitus is lower, shorter than 3 months. It can be cured, but more than 3 months, I think just do our best, because it's the most difficult for us to fully recover. It can be alleviated very good, but it is very difficult for recover. Besides, treatment effectiveness gradually decreases with age. Then degenerative tinnitus is more difficult to treat. In my experiences, the elders' tinnitus is very, very difficult. Maybe we just do our best. Maybe I think this is the organ degenerations. So maybe it's we cannot assist it for neurological disease for degenerative symptoms. And then I will introduce the key points. A points, tinnitus points, and the vestibulocochlear nerve points are important. Besides, it is important to identify the underlying causes of tinnitus before initiating treatment, such as hearing loss, Meniere's disease, or other contributing conditions. Because tinnitus usually accompanied with other diseases such as hearing loss or something. We have to find out what exactly disease they have. So if you want to have a better efficacy, I strongly suggest you have to find out what is the disease they exactly have. Because just as with the patient have a Meniere's disease, we have to solve the Meniere's disease first, and then the tinnitus will become better. About hearing loss, we have to solve the hearing loss first, and tinnitus will become better. Okay. Let's introduce the case report. 1 week ago, a 37-year-old female office worker reported sudden onset of tinnitus in left ear, describing it as a combination of static radio noise, and a passing train sound. Current symptoms are tinnitus, mild dizziness, and decreased hearing. About pure tone audiometry test, left ear hearing thresholds are 215 Hz is 40 decibel, 500 is 30, 1000 is hem, 2000 is 15, 4000 is 20, 8000 Hz is 30 decibel. I will introduce the Hertz means of this PTA later, because I will focus this graph on this from the sudden sensory neural hearing loss. The ICD-10 is H9312, tinnitus, left ear. About Hoku diagnosis, I found the left cervical area exists positive reaction. Here exists positive reaction. And then upper extremity diagnosis, I found left cerebrum and brainstem area exists positive reaction. About neck diagnosis, I didn't find anything. About YNSA somatotopes, basic points is left 8 points. Sensory points are left tinnitus points. Brain points are right cerebrum points and brainstem points. 12 cranial nerve points are left and right vestibulocochlear nerve points. Here is the result. Third visit, the patient reported improvement in dizziness, but no changes in tinnitus. Fourth visit, left ear tinnitus has improved. The static radio-like sound had resolved. The patient described a subtle abnormal sensation in the ear, similar to itching. Fifth visit, tinnitus in the left ear had completely resolved. The patient felt that hearing had improved, although no formal audiometry was performed. The itching sensation in the ear had also subsided. The patient decided to discontinue the treatment. Okay, this is also the very successful treatment of tinnitus because we just used 5 times for tinnitus. Just I mentioned, the tinnitus case, it can be alleviated, but the full recovery is very difficult. And this patient has got a good outcome when we are using YNSA. And then you see that the patient exists some hearing loss in this patient, hearing loss, but we don't know what is the reason. Because the female didn't tell me what hearing loss what the other ear disease they had. Maybe just a normal degeneration, or sometimes maybe some inflammation in the ear in the childhood. But we still recover these cases. I think these very successful cases for me to share it with everyone. Okay, let's move on to the demonstration video. Thank you. Let me introduce the treatment of tinnitus. Here is a point. Here is tinnitus 1. Here is tinnitus 2.
Here is tinnitus 3. Here is tinnitus 4. Here is vestibulocochlear nerve, cranial nerve 8. Here is cerebrum point. Here is spleen point. This is the treatment of tinnitus.
Okay, we finished the video and let's continue to the next case.